The issue of brain health equity, of course, is a very important one, especially because we know that the population is aging and the incidence of many neurological conditions correlates with rising age. And as I had mentioned previously, we also know that because the demographics of the population are changing in terms of race, ethnicity, that as the population ages and as the demographics in terms of race, ethnicity change, you're going to see a widening of disparities in neurological diseases. So more prevalent neurological diseases, but a widening of the gap between non-Hispanics, whites, and many minorities. So some aspects of neurology have been very well studied. For instance, stroke. We've known for over 50 years that there's a big disparity between African Americans and their non-Hispanic white counterparts when it comes to stroke outcomes, whether it is the incidence of stroke or dying from a stroke. And as a result, a lot of work has gone into trying to find out what exactly is contributing to that and trying to bridge that disparity. In 50 years, we're still not clear. We have some answers, but we don't have all the answers. But what's especially important is beyond just the answers, we really don't have any key solutions or interventions at this point. And so the health equity talk was to really point out that these disparities are there and they're lingering, and they're most amenable to actually identifying solutions or interventions rather than continue to illuminate them. There's a disparity here, there's disparity here, but what actually is the solution? The talk also focused on the solution probably being at the level of the social determinants of health. I'm a neurologist, and so many times when I see patients, it's at the point when they already have neurological disease. That's why they come to see me in the first place. But really, the best way to try and potentially breach these disparities is to look at those social determinants of health, whether it's where a person lives, what a person's income is like, all those factors, all those discrepancies between minorities and many non-Hispanic whites, or when it comes to even rural dwellers versus urban dwellers, those factors contribute to the disparities we see in medicine generally and obviously in neurology as well. So the issue is, what do you do about it? So, of course, having more dedicated funding for disparities research is important, especially disparities research that focus on interventions, trying to solve the problem, trying to aim at the social determinants of health, because at the time when neurologists see the patients, probably the horse is already out of the barn. So it would be helpful for us to intervene a little bit earlier. There's no question that when you look at many neurological studies in terms of not just outcomes, but care, there seem to be disparities in care. It looks like many minority groups tend to get evidence-based procedures less often than their non-Hispanic white counterparts. They tend to get tested less often than their non-Hispanic white counterparts. So even in the health system, at the level of the health system, there are opportunities. I spoke about implicit bias. I spoke about cultural competence. There are opportunities. And then I spoke in the health equity course about trying to partner with the community. Many organizations reside in communities where there are lots of minorities, and those minorities are experiencing disproportionately greater burden of disease. I think it's extremely important for a department of neurology to partner with the community. For instance, I mentioned forming a community advisory board that would consist of leadership in the Department of Neurology, as well as community stakeholders as well. That helps to foster an understanding. It allows the university to better understand what the problems are in the community, but it also allows the community to have better trust in the Department of Neurology or in the medical system itself. And so then I gave an example of a Bay Area in San Francisco here initiative that has been very successful in reaching out to the community and trying to bridge inequities when it comes to disease.